The National Institute for Health Research is sometimes abbreviated to the NIHR, and our mission is to improve the health and the wealth of the nation. At the NIHR, we hold the largest database of information to do with clinical research. We had no way that we could actually create meaningful analysis from it. Our biggest challenge in terms of the amount of data that we have is actually the speed that it changes and the way that we need to be able to report on it in near real time. Previously, we would have had a team of information analysts who would have interrogated the data using Excel, maybe created pivot tables, and they would have uploaded this information onto the portal, where people from all over the country who are part of the NIHR would have accessed this information from SharePoint, and they would have downloaded it and probably created further pivot tables on it. We realised that there was an awful lot of duplication of work, and the time that it was taking to actually produce these Excel spreadsheets meant that there was no time left to actually interrogate the data, which meant that we weren't able to actually gain any insight from the information. We use QlikView to look at a number of different data sets. The data sets that we hold vary from information to do with time, so how long it would take to actually carry out a study. We hold data on the types of study which are going on, and we also hold information on the performance on those studies. So we can record where a study is taking place, how many participants are in that study, how long the study's been going on for, how long it took to get permission to carry out that study. But we can also look at the performance against it, and we needed QlikView to be able to capture all of those items and report on them all and be able to compare them. Previously, we had 55 different systems which all reported locally. What we've managed to do by putting this information in one place is work on a collaboration between all of those different areas. It's creating one platform that people at a local level and at a national level can access and view the same information. So far we have 1,500 registered users. This covers over 102 local research networks who will all have access to this information and be able to use it to interrogate and analyse the information. Using QlikView over our open data platform has helped us improve the way that we do clinical trials in terms of the speed, the quality and the cost reduction. By using QlikView, we've been able to identify different trends in performance and analyse these trends, so we can now see performance at a local and at a national level. For example, we had a study which took place last year, which using QlikView we actually identified that it had an advertising campaign in Men's Health magazine, and the month after that advertising campaign there was a peak in the number of recruits. That information has always been held in Excel, but until we actually put it into a graph and could visualise that data, we'd never actually identified that there was a peak in a particular month. QlikView was the metal detector to help us find that needle in the big data haystack.